Well, good afternoon and welcome everyone to the Healthy Habits webinar series, which has been taking place every other Thursday from June 17th through September 23rd from 12 to 12:50 p.m. We are so excited to have you all with us today and so pleased with the turnout. We are expecting over 550 participants on today's webinar. I'm Julie Chabdi, Health and Wellbeing Program Manager with the Center for Work and Family Life. And it's my pleasure to spend the next 50 minutes with all of you. A few housekeeping items. We would like to invite you all to stand if you're able and stretch anytime during today's presentation. So feel free to get up, move around, and wiggle it out. Your audio is being muted to minimize any background noise until we open it up for Q&A. But feel free to use the chat function at any time to make comments or to ask questions, and our presenters will assist in responding. This webinar is being recorded and will be archived for sharing on the Healthy Habits webpage that you use to register for the series. The current pandemic has disrupted our lives in so many ways. USC faculty and staff have spent the last year and more adjusting to a new norm of working, learning, and living at home. We all understand and acknowledge that this has been a very difficult and ever-changing time for all of us. With the return to on-campus activities this fall, many of you are faced with emerging challenges to maintain your current work and personal life routines, healthy habits, schedules, and environments. Whether you'll be returning in person this fall, started the transition already working a hybrid schedule, a remote schedule, or maybe have been on campus this entire time, we want to provide you with information and motivation to create and maintain healthy habits. So this series aims to support the health and well-being of our campus community by providing you with strategies and resources to help you navigate the transition and recovery of the pandemic and to continue and establish healthy habits that will last a lifetime. Here's a look at our 8-session webinar series. Today's session is number 6, on wellness perks and benefits. We hope you will join the other sessions as well. So let's get started on today's topic, wellness perks and benefits. We hope that you'll find these resources valuable as part of your overall employee experience at USC. So today's agenda will include information on health and wellness benefits overview, perks and discounts, the Center for Work and Family Life resources. We'll have time for Q&A, and in a preview of the next session. So with that, I am honored to introduce our 3 presenters for today. We have Alice Chen, Assistant Director of Health Plans, Awilda Bergan, Director of Benefits Administration with Human Resources, and Dr. Laura Hilton, Director of the Center for Work and Family Life. So now I'll turn it over to Alice to kick us off.
Thank you, Julie. Hi, everyone. Thank you so much for joining us today and just taking a time out of your busy schedules to learn more about resources for your well-being. Today, I'm going to be going over a few topics. I'll be starting with an overview of health and wellness benefits available to you, just employees only. And then I'm going to do a deeper dive into what resources are available by medical plan that are available to you and your dependents enrolled in them. Thank you. Next slide. This is a great summary slide overview of the resources I'm going to take a deep dive into in the next few slides. But I think this is a good slide to kind of go back to later after our presentation, just to be able to go through and see which resources are there, and a quick view of the contact list. To start, I'm going to be going over the things on the left, which will be all benefits eligible employee incentives. There's a link below in the yellow box. That's a quick go-to link that has all the fact sheets of these details you can refer to after. And then, of course, our office health plans is here to answer your questions at any time. After that, I'm going to be going over the middle column, which will be all resources for those enrolled in the USC PPO, Trojan Care EPO plan, and EPO Plus plan. And then I'll end with the Anthem HMO and Kaiser HMO resources. Next slide, Julie. So the first program I want to highlight is the Health Assessment Incentive. We've partnered up with a new vendor this year called Vitality. And with this incentive, you can earn up to $480 off your medical premiums by completing 2 steps. One of them being an online questionnaire called the Vitality Health Review, and then an in-person screening called the Vitality Check that you can complete through your primary care physician or LabCorp. I do want to point out on Monday, we just announced a new update, which you can actually, we extended the program deadline to December 17th. So there's still time to enroll and complete these steps to earn credit for 2021. And then in addition, we've extended this to give you credit for 2022 as well. So you don't have to rush in the fall and you don't have to do any additional steps. Now, if you've already completed both steps and you're earning the credit today in 2021, good news is you automatically are going to be earning that credit for 2022, no additional steps. So if you haven't taken this opportunity to participate in this incentive, we highly encourage you to check it out. In addition, this website has like a lot of different comprehensive wellness resources for you. You can track your health goals. After you complete your online health assessment, they have like articles and risk factors that are identified and can help you address those. You can also sync up your fitness device and track your performance there. If you want more information, there's also a link on that site, and I think Suzanne just put that up. Another incentive we're offering again this year is the Fitness Incentive Program. Again, this is for all benefits eligible employees. It does exclude Verdugo Hills and postdocs currently, but this program is designed to encourage you and support a healthy lifestyle. We reimburse you up to $220 per year on any eligible wellness activities. They can include gym membership, fitness classes, and many more. We encourage you to register at wageworks.com, and then there's complete details of the rules and additional listing of the eligible expenses. I know with the pandemic, a lot of the gyms were previously closed, so we did actually expand the list to promote more outdoor activities. So we've added like fitness shoes and bicycles. So check it out if you can. And then the last subsidy incentive program for all benefits employees is GymPass. We've partnered up with them to offer discounted membership to gyms. Now they've expanded to different wellness and fitness classes and apps. As you can see, I've included some popular classes that have recently been added in the LA area, like Barry's Boot Camp, Soul Cycle, and Equinox. This is a good way to try out different gyms and not be committed to just one gym at a high price. The yellow box lists the current pricing if you weren't paying with GymPass, and then the red column will be the discounted rate. They will have updated rates starting October 1st, so I went ahead and included that here. This benefit is available to you and your dependents. And then you just sign up at your own timeline. You can cancel anytime. There's no lock-in. You would just put in your credit card and sign up through their website. Next, I'm going to be diving into a suite of programs and resources for those enrolled in the USC PPO, EPO, and EPO Plus plans. I've indicated on each of the slides with a little yellow box with a Trojan head, just to kind of separate them out to let you know who's eligible for these programs. So Lyra is our mental and emotional health resource for those members. They offer behavioral health resources and therapists through technology. It's really easy to sign up through their website. They have a lot of different convenient options. You can meet either through video, phone call, in person, quick scheduling, and members get up to 25 free sessions a year. So this is a great benefit to take advantage of. The next item is a diabetes management program for our members. It's through a vendor called Livongo. Through this program, both you and your eligible dependents can enroll. They provide a connected online glucose machine monitor to help keep track of your insulin levels, and you can get real-time help. Those who participate in this program and use their meter regularly, you are also qualified to receive free diabetic medication and supplies. So your copay will be waived if you're enrolled in this plan. And I believe I forgot to include the link here, but if you need it, it is on my summary page. And oh, thank you, Suzanne. She's included that there as well. The next program is USC Premier Care. It's actually a concierge service through Keck Medicine. So for those members in the EPO PPO Plus plan, if you seek care at Keck Medicine or use USC doctors, this is a great care management program for you that's free. They help with a variety of services, from scheduling your appointments to wellness services, medical management, if you have care transitions from a hospital, reminders on cancer screenings. They have a lot of great programs. So we encourage you to visit this and check out their services. There are flyers included here, but if you want more information, you can visit keckmedicine.usc online, Premier Care. The next item is a telehealth medicine platform available to those also included in the EPO PPO Plus program. Telehealth has become really popular these days. We don't want to leave our home, and this is a safe way to quickly get your questions answered. You can see a primary care physician through there or behavioral health. Your standard copay for office visits does apply, but they're there to answer your questions. They can even prescribe medication if you need to. A link is included here to sign up. And then that transitions me to tell you more about the primary care physician incentive program. So I told you about Live Health Online, the standard copays apply. Well, if you sign up and elect a primary care physician in our Health Comp portal, then you will receive $10 off your office visits with your primary care physicians. And this would also apply to telehealth. The reason why we've incorporated this benefit is just that we've learned that if you build a relationship with your primary care physician, that encourages healthier behavior, having some accountability. You aren't locked into this primary care physician that you choose. It's just a good practice to find one if you're in a time of need and need a resource. So we encourage you to sign up for this free benefit. And then now I'm going to dive into resources for those employees and members enrolled under the Anthem HMO Wellness program. They offer quite a few contact information for different programs. They have a condition care program. So if you're going through any current chronic care needs, they can help reach out and provide additional services or questions. There's a nurse on call to help you manage those. They have a Future Moms program. If you're currently pregnant or planning that journey, they'll help you keep on track and provide tips for staying safe. And then there's also a 24/7 nurse care access phone number. One other service they're providing for members is an app and mobile online program called MyStrength. It's been really popular, and I've heard really great things about its resources that helps with support with emotional health and well-being. So you can download that service free to you. And then we also have more detailed information about these specific programs on our Employee Gateway website. They have a fact sheet for each of these services that you can check out online when you have time. And then the last slide I want to go over is for Kaiser HMO members. There's quite a few links here, but Kaiser just offers so many great resources out there, from mental health to wellness coaching to online classes and programs. You have so many choices if you want to quit tobacco, lose weight, reduce stress. All of these links here can fit any one of your needs. There's also, similar to Anthem, there's free self-care apps that are available, like Calm and MyStrength, that you can check out. And then we've included a link at the very bottom to our Employee Gateway site that, again, lists details on each of these programs for you, with fact sheets and contact numbers that you can reach out to if you have any more questions. And that's it for me for now. I'll be happy to answer questions on the chat after this or after all our presentations, but I wanted to turn over to Awilda Bergan, our Director of Benefits Administration. Thank you.
Hi, Alice. Thanks for the segue. Good afternoon, everybody. So I'm going to be covering or highlighting three particular benefits. One which goes hand in hand with some of the things that Alice just covered, and two which highlight things that you can do to prepare yourself for a variety of stages in your life, as well as things that you can use while you're employed with USC. So if we can go to the next slide. So the first benefit that I'm going to talk about, which, as I said, goes hand in hand with some of what Alice talked about, is a wellness benefit that is associated with our new life insurance carrier, MetLife. You may recall that as of January 1 of 2021, we switched to a new life insurance AD&D insurance carrier. And part of what they offer, MetLife offers, is a critical illness and a hospital plan. And each of these plans provide a monetary benefit to those who are covered. For example, under the critical illness, should you be diagnosed with one of the illnesses that's part of the program, there is a monetary one-time benefit that is paid to you just because you've been diagnosed with that particular illness. But the other sort of wellness piece to critical illness and the hospital plan is the goal is to keep you healthy. The goal is to have you monitor yourself on a yearly basis so you can make sure that if anything is happening, it is caught early. And so as an incentive towards that, these two plans have a monetary incentive for your annual screening. So for example, the critical illness plan, if you are an enrollee in that plan, if you are a female and you go in and get your annual mammogram, they will send you $200 for having that annual exam. If you also go in and do other screening or prevention tests, like in colonoscopy, for an example, and right now, if you've had your COVID vaccine, you can submit that to receive a monetary benefit for that. $50 for those preventative screenings. The hospital plan has the same preventative screening benefit, which is $50. Again, if you've had your vaccine, you can submit that. If you've had a colonoscopy, you can submit that. I personally did have the critical illness plan, and I submitted for A and B and had a nice $250 deposit directly into my checking account within 3 to 4 days of submitting the claim on the MetLife website. So again, if you are enrolled in any of these plans, then you are eligible for this monetary benefit. If you have dependents covered under these plans, you would not only get the benefit for yourself, but you would get the benefit for your dependents if they're covered by the plans. The benefit is an annual payment, calendar year. So every year, when you go through these particular preventative testing, screenings, every calendar year you can submit a claim to get the monetary benefit. And if you want more information, you can visit the link listed below, which is the mybenefits.metlife.com. That is a dedicated website for USC employees, and it will have all of the information relative to the MetLife plans that are currently available. I do want to throw in one sort of not wellness or healthy habits related, but as I mentioned, we switched to this new insurance carrier January 1. During open enrollment, it was communicated that because this was a new carrier and because we are now the record keeper for all MetLife related benefits and plans, it was required of all employees to go into Workday during open enrollment and assign your beneficiaries. We have seen with audits that were done in the first quarter of this year that not everybody did that. So just encouraging you to, if you didn't go in during open enrollment and assign your beneficiaries, please do so now. It can be done at any time. And even if you haven't purchased any additional life insurance and you only have the free USC basic plan, you still need to go in there and assign a beneficiary in case you decease, we still need to know who to pay the basic benefit to. So it's not only for those that have purchased voluntary insurance, it's for everybody, because everybody gets a plan for free from USC. Next slide, please. The other sort of healthy habit that I wanted to talk about is, depending on where you are in life, a lot of people have already started planning and doing their financial and planning for potential retirement. And so I just wanted to highlight that there is a financial wellness component to what we offer, and that is offered through our 3 retirement vendors. It is a 30-minute session at no charge. You can sign up at the links that are listed here. Those go directly to that retirement vendor. It will show a calendar as to availability, and you can just go right in and schedule your counseling or consultation directly on that link. We recommend people do this at least once a year, maybe every couple of years. You may have had a change in job and a change in salary, or a change in your personal situation. And so it's always a good thing to do a consultation with the retirement vendor that you're currently investing with, just to make sure that you're still doing what you need to be doing, and sort of keep you on track for whatever your financial goals are. Next slide, please. And then the last thing that I wanted to discuss is, as a USC employee, we get, not necessarily as a benefit, but we get lots of perks and discounts that we can avail ourselves of. There's a variety of them. I've listed only an example here. It is not exhaustive. There are many more than the ones listed here. As you all probably know, the USC bookstore offers a discount. The USC ticket office offers discounts. You can receive discounts by joining one of the USC gyms. The big one is the USC neighborhood home ownership program, where employees can get up to $50,000 towards the purchase of a home in one of the USC outlying areas. If you want more information on that, we recommend you go to the USC neighborhood home ownership page on the USC website. Another great perk is the Natural History Museum on Exposition. If you show your USC card, you get to go in for free. Also applicable for the La Brea Tar Pits. If you show your USC card, you get to go for free. And as I said, this was just a brief example of all the things that are available. There are many more. And so we recommend that you go to the link that's listed here, usc.edu/perks, and you will be able to see the complete list of perks and discounts that are available to all of us. And with that, I'd like to hand it over to Laura Hilton from our Center for Work and Family Life.
Thank you so much. Please, there we go. We're on the next slide. Thanks. I'm Laura Hilton. I'm the director for the Center for Work and Family Life. We are your work-life health and well-being resource. And I first want to thank Alice and Awilda. I'm so glad to see all those robust benefits that are explained in more detail. It makes it so much easier to navigate and explore. So thank you so much. And thank you, Julie and Suzanne, for inviting us. I would like to just take a pause right now and ask you a question, put a question for you to ponder. What if we recharged our batteries as often as we did our phones? And then I'd like you to take a moment to either mentally share or mentally note or share in the chat how you best recharge your batteries. Is it rest, cooking, visiting friends, seeing a movie, playing with your kids, walking the dog, reading? I'm saying all the things I like to do to recharge my batteries: vacation, rest and self-care, yoga gym, hiking, exercise. I picked up tennis during the pandemic, which is amazing. So what recharging activities can you commit to doing today? I see a lot going through here. So let's try to bolster that and harness that thought. Next slide, please. So our center has provided services for Trojans for over 40 years. And as the world around us changes, so have we. We've enhanced our programs and are refreshing our look, our name, we're getting a new website, and our goal is to empower employee work-life wellness. So we're offering free and confidential work-life resources for USC benefited eligible employees, including faculty and staff, postdocs, their dependents, and retirees. In the current remote work environment, and now that we're returning to campus and we're masking, we are serving clients via phone and Zoom mostly for the following services. We call this our wheel of services. So we provide consultations for leaders, managers, supervisors to support, empower, and manage their teams. We're experts in human behavior in the workplace. We're offering professional coaching for executives at the director level and above. We develop and deliver talks and groups for department schools and units on a variety of wellness topics. We currently have a working parent drop-in group and a Slack channel that is very popular. So you can email us for those details. One of the key components of what we're here to deliver is critical incident stress management. This is where we come in after a high impact event for psychological first aid and recovery. We are doing short-term counseling. So this is problem identification, assessment, and short-term solution-focused intervention to help employees identify and resolve personal concerns that may affect work. And we support navigating health plans, the health plan benefits for any long-term counseling needs that our faculty and staff may have. Last but not least, our health and well-being program is led by Julie, who's driving strategy on the culture of health and creating impactful programming like Healthy Habits and the USC Healthy Campus Initiative. Next slide, please. Our staff of licensed clinicians and health and well-being experts are here to support you and your teams to live well and to work well. We have offices at University Park Campus and Health Sciences Campus, and we're back on campus starting next week. If you call our main line, you'll likely reach Susan Huddleston, our office manager, who'll provide you with a warm handoff to services. Next slide, please. So we always have programs underway and in development. Our current programs include this Healthy Habit webinar series, consultations for leaders and their teams to support the transition of returning to campus, our longstanding Parent Connect drop-in group on Wednesdays at lunchtime and Slack channel, which serves USC employees who are either working parents or caregivers. As part of our enhancements, we are working with senior leadership on the USC Healthy Campus Initiative. This is a comprehensive collaborative strategy to infuse health and well-being in policies, procedures, and practices at USC. And we're relaunching our successful Thriving Thursdays series later this fall. You can find our work-life well-being presentations and resources listed on Monday's Gateway announcements and the USC calendar. Also, if you'd like to be added to our listserv, please email us at cwfl@usc.edu. So that's an overview of our services. We've been so excited to have the Healthy Habits webinar series be so successful, be able to be impactful, reach so many people, and help get those rich benefits out so that we understand what's here for us and how to navigate all of these incredible options that we've got to support our health and well-being. So with that, I think there are probably a lot of questions that came up, and so we'll turn it back over to Julie, our host.
Great. Thank you so much, Alice, Awilda, and Laura, for that brief overview of all the great resources we have here at USC. And we have a lot of questions, so I'm going to go ahead and just ask live to our presenters the questions that have not been answered yet in the chat and Q&A. And I'll start off with Alice. There's a question for you, Alice. Are the programs from Anthem and Kaiser only accessible to its members?
Yes, so the ones I highlighted specifically for Anthem HMO, those would be for just the employees and their dependents enrolled in that plan. Same for Kaiser HMO, and then I did a group for PPO, EPO, and EPO Plus. Those would all be the same together.
Great, thank you. A question for Wilda on the MetLife benefit. Is this only if you're diagnosed with an illness? Can you expand on that, Wilda?
Yeah, so the critical illness plan is the main purpose of that plan is to, if you get diagnosed with one of the illnesses that is listed under the critical illness plan, then yes, you would get a one-time benefit from there. But the wellness benefit does not require a diagnosis. That is an annual benefit that you can claim based on, and the amount is based on the type of screening or test that was done.
And I put your slide back up there just so the details are there. Great. And can you confirm, is it $50 for each screening or $50 total for the year?
$50 per each screening.
Okay, great. And we had a couple of questions, Alice, for you about the Gym Pass benefit. Can you briefly, I'll go back to the slide, a couple of questions around what that is exactly and the link to it. If you don't mind doing a brief spiel again.
It's a discount program for Gym Pass. They're a company that has a network of gyms, fitness classes, and apps all in one. So it depends on the plan you select. So the more expensive plan have a wider network, and then the cheaper one has like a smaller network. And basically that monthly fee gives you access to whatever is listed per that plan. If you are interested in signing up, there's the email and phone number there. I think they're updating the link, the formal link in a web app. So I'm going to have that be sent out with Suzanne. I apologize, I don't have that on the slide, but that's the way you would sign up, and it's on your own. So you would put your credit card, and then you would list whether you want to sign up or you want to list some family members to be included in that package.
And what about gyms that are not listed, like, for example, the YMCA or other gyms? Have you considered, or how do people make suggestions for other gyms that might not be in the network? Sure.
I believe Gym Pass is always constantly contracting new gyms all the time. So I believe there's a way to make suggestions. I'm happy to take those suggestions. If you sign up and you don't see the gym that's there, I can pass that on. You also have the email there to submit a request. But it's constantly being updated, so I would check back. And then, depending on the different plans, you'll see more as the tier goes higher.
Great, thank you. And there was a question about, is there a gym for faculty on campus? And to my knowledge, there is not. There's just the 3 main gyms, 2 on campus and 1 at HSC. But next session number 7 on September 9th, we'll cover healthy foods and fitness opportunities and resources on campus. So I'll ask the presenters to address what future plans they might have for faculty, staff only type of services. Back to Wilda, how much does the critical care insurance through MetLife cost?
It depends. There is a range of costs depending on the level of coverage you choose, and whether it's just for yourself or for yourself and your dependent. So if you go to the benefits website, on the USC website, so the benefits page on the USC website, and click on insurances, you should be able to determine by looking at that what the cost would be for you individually.
Great, and we're getting a few questions about the fitness incentive. So let me put that slide back up here, and more information can be found at that link there. Alice, question for you about the health assessment credit. Can you confirm if that's just for the insurance holder, or is there a potential benefit for any adult dependents that might be on the plan to complete the health assessment?
So currently the program is just for employees only. You don't have to be necessarily enrolled in a medical plan to access Vitality and the resources and take the assessment, but you won't get the credit unless you're enrolled in a medical plan, because it's the discount off your medical premiums that come through your payroll.
Great, okay. And a question about how does the Calm app work?
I personally don't have it specifically yet, but I believe the link I gave you or provided online should have instructions. What I'm told by friends that have used it is it provides different resources. I think there's like breathing exercises, meditation, but you would go to that website and I think has instructions on how to download it, to put in your plan information, and then sign up from there. If you have any problems with the sign up, please contact our office. We can direct you to a Kaiser or Anthem resource person to help you with that as well.
Great, thank you for that, Alice. And then someone's asking about the $10 for the PCP and how that works. The primary care doctor incentive.
Okay, so if you're enrolled in the APO or PPO plan, we use HealthCom as our third-party administrator. So they log in all our claims information. You can access your ID card. So it's a great platform if you're a member in those plans to use that. In that website, you can elect, you would search for a provider that you want to choose for your primary care physician. You would elect that in your registered account. And then once that's in, you'll begin receiving a $10 discount off your office visits automatically. So typically, if you're in the PPO plan or APO, I believe it's like $20 to see a primary care physician, you would get that $10 off. And so then it would be $10 for the EPO plan. And then for PPO, it would be $30 for a primary care visit.
Great, and I'll go to Awilda. Awilda, is there a list of approved health screening procedures for the $50 incentive for the MetLife insurance?
There is. So you can either find it on the USC website, the benefits page. And if you go to the insurance tab, it should get and click on critical illness. It'll show you what the covered illnesses are. You can also probably find them on the MetLife USC dedicated page, which is the link that I provided on my slide.
Great, thank you. Does Gym Pass include the John Reed Gym at the USC Tower?
I'm not certain right now. I don't have a whole full list of the networks. I encourage you to visit the site to see it, but send an email. I'm not aware of it currently, but these were just kind of some name brands I put on. Thousands of gyms listed.
Great, okay. I don't know if anyone has seen a question, maybe we skipped over. There's so much activity in the chat. This is great. I think we covered most of it. Let's see here. I don't know if any of you know anything about a public service loan forgiveness. That wasn't covered in today's presentation, but it was asked in Q&A.
Yes, and that probably should have been added. The public service loan program is where people can go and learn information about having their student loans reduced, if not forgiven completely. If you go again to the main USC website, and then in the search bar, you can type in public loan forgiveness program, or you can type in payroll. Payroll is the one that manages that program, and you can scroll down the payroll page and find information on that. But yes, because you work for a nonprofit organization, you might qualify for forgiveness of your student loans if you have them.
Great, thank you for answering that, Awilda. MetLife app is asking for an access code. What is the USC access code, Awilda?
Oh, very good question. I didn't realize that it was asking for that. Go on to the next question. I will
Sure
have an answer as soon as I find the answer to that.
Wonderful. And this is a question which I can confirm, does the $220 work for bikes or other exercise equipment for home? Yes, right, Alice?
Yes, it does. And I would just, just to be certain before you purchase anything that's really expensive or you're uncertain, I would just encourage you to visit the website to see all the eligible expenses. We update that often. So just make sure you check before you submit your receipt.
Question for either Awilda, probably Awilda. Are there resources to help develop a will?
Yes, through the MetLife legal plan. If you are enrolled in that plan, they will assist with wills and trusts, as well as a plethora of other legal benefits. You do need to sign up for it. There is a cost involved, and you can only sign up during open enrollment. So if that's something that you're interested in, I would look at it during this year's open enrollment. Again, I will give a personal sort of shout out. I have the legal plan. I used it to create my trust this year. And you may or may not know that depending on the complexity of your estate, trusts can sometimes run from hundreds to thousands of dollars. Mine is not very complex, but all I paid for will be the notary fees. Everything else was covered under the plan, so there were no additional fees. So again, if that's something that you and your family need to take care of, which I recommend you do if you haven't, you can sign up for the MetLife legal plan during open enrollment, and then January 1 of next year, you can begin using the benefit.
And we thank you, Awilda, for that. And we had a comment here, just to everyone can make note of this, and we'll update it when we send out the information, is the web link for the Vitality Health Assessment, wellness@powerofvitality.com. So thank you for that updated link there. Okay, question here. The $220 tax, is the $220 tax since it comes through payroll for the
Yes.
fitness incentive?
It does count as income, so you will be taxed post-tax after in your payslip.
And any idea, Alice, if the fitness reimbursement includes maintenance for, say, like bike repairs or a helmet or bike stand, lock, accessories?
Currently, it doesn't include maintenance. It's just for purchasing equipment. There are some accessories that are eligible, like helmet. I think safety. I'm not sure about, I don't think locks or bike stands are included, but more for safety.
Mm-hmm. And when is open enrollment?
Open enrollment, we should be announcing that within the next couple of weeks, but it'll be from late October to early November, the typical 2 weeks. And there will be tons of emails and announcements once communications is ready to send that out.
And just to address the question about all the links, yes, we will be sending out this presentation to all of you afterwards. So you have all the links, and any additional links we may not have had in some of our slides, we'll make sure we get that over to you as well. Let's see here. I use a Fitbit watch. Can I enroll that to get the benefit through WageWorks? So that's
Yes, that is an eligible expense. I know that, but it just make sure that when you're claiming it, you purchased it in this year. So the expense is only for the current year you purchase it. Thank you.
Okay, here's a follow-up question on Calm app. Do you need to have Gym Pass to get discount for using Calm app?
No, that's just one of the avenues to get it. That's like one of the programs they have. But if you're in the Anthem or Kaiser HMO, I believe that's a free app within their plan. Otherwise, you can download it directly from the Apple Store or your mobile store. I'm not sure what the rates are for that.
Right, yeah. Question, Awilda, I don't know if you know this because this was outside the scope of our presentation today, but can you add funds to your flexible spending account?
During open enrollment, yes. So for the flexible spending account, you must re-enroll every year. If you do not enroll during open enrollment, you will not have an account for the new year. So when you enroll for the new calendar year, you can put whatever funds in there you think you might need for co-pays or other health-related expenses.
Great. A follow-up question about the bikes. Again, a lot of bike riders here at USC. Are wheels for road bikes covered through the fitness incentive? Do we
I
know?
believe so. I think it's under bike accessories, but you double check with the WageWorks website. That will be your true source.
Great. And the Wilda just put the information. Oh, actually, see here, the MetLife. I'm going to copy and paste that so that everyone can see that, Awilda, for
Yeah.
the.
Yeah, and just, while you're waiting for it to come in, the link that I referenced on the slides is the link for those that already are enrolled in one or more of the MetLife plans. The one on our benefit website that has just generic information for everyone to review is at the www.metlife.com/USC. Or you can go to the gateway, click under benefits, and then under insurance, and you'll be able to click directly from there.
Question for Awilda. Are there considerations for additional benefits for employees that do not use the USC health plans like the COM app, or Alice, whoever can answer this one?
Yeah, that would be Alice.
Sorry, can you repeat the question one more time? I was reading.
Yeah, are there considerations for additional benefits for employees that do not have USC health plans? Like
Yes,
the COM
definitely.
app?
We're always looking to grow programs and assess the needs of the employees. So if you ever have any feedback, you're welcome to email our office, healthplans@usc.edu. We're happy to listen and get feedback. We're hoping to do a survey, early next year to just learn more about employee needs and preferences. So appreciate that.
And I think we have time for one more question. This one's for you, Awilda. And is there a benefit that offers financial advice? And I know we've covered this. If you want to expand on that question.
Yeah. The benefit that we have right now is the one mentioned in the slides, which is through our retirement vendors. There is not a benefit right now just for overall financial planning. That is something that we've been sort of looking to see if there's something out there that we think would be appropriate for our employees. But if you work with your retirement vendor, they might be able to assist with some just generic financial planning. And I know a lot of them may have resources on their websites that can assist with that. It might be sort of more directed towards, where are you financially and what changes you may or may not need to make in order to meet your retirement goals. But if you talk with one of the retirement vendors, they can let you know what's available through them.
Great, thank you so much. So we're just out of time. I'm just going to wrap up quickly and say thank you everyone for sharing all the wonderful, robust benefits we have as USC employees. And thank you all of you for attending today's Healthy Habits webinar. We will be sending out this presentation, so you have all the links and all the resources to reference back to. We'll also ask you to fill out a survey to give us feedback, and we'll send out the link to the recording so you can share that with your colleagues or rewatch if you'd like to. And with that, I will give a short preview on our seventh session taking place on September 9th, focused on healthy food and fitness on campus. Presented by Lindsay Pine, registered dietitian with USC Hospitality, Corinne Muldrum, fitness coordinator with Rec Sports, and Tommy Mavartsakis, fitness specialist, Rec Sports. So we hope to see you all there as we highlight all of the options to eat healthy and to move more at USC. Thank you and have a healthy day.